Hello, this is our first week home with our new baby number 3. And this week I want to share with you all the things to expect if this is your first week home postpartum with your new baby. If this is your first time meeting us, I'm Sarah. I'm a board certified OBGYN, mom now of 3, and we have this channel with my husband who's a pediatrician where we share all things birth, baby, postpartum, and beyond. So stay tuned. All right, so this week I am going to talk about everything kind of to expect for mom that first week. I just handed off baby Hank to dad. We also have an episode all about kind of what to expect with that first week home with your new baby. So like the baby side of things. So be sure to check that episode out as well if you're wondering what to expect with baby. So you're home from the hospital. They let you broken and bruised, leave the hospital with that sweet baby. Congratulations. No matter how you delivered, you did an amazing thing bringing that baby here. It's also a tremendous amount of physical work. And now you are home to recover and adjust to life with a new little human who is often, as Kurt says, unreasonably unreasonable. So what are things you should expect? And how do you kind of optimize that when you're home? So things that are kind of going on. Still, you're still bleeding, okay? And so things that you're going to be good friends with are still those giant mesh disposable undies. Often the hospital has extras, so take them home. Take that extra bag home. Same thing with the ice pads for those first couple days home. I really like to sit on and put a perineal pad, ice pad on to help with swelling and inflammation, as well as taking ibuprofen and some Tylenol, acetaminophen, kind of every 6 hours if you are sore, helping with inflammation to just stay on top of that. So your bottom's still going to be really sore. You are still going to be bleeding. That bleeding really lasts 2 to 4 weeks postpartum. It should be getting kind of lighter gradually as the days go on, but it's still very much a thing. So be kind to yourself. Sitz baths are okay if you want to get in a bathtub. Clean water, fine. Pools, swimming, other things we say do not do because that's dirty water. Your cervix is still open after having a baby, so no like swimming in a pool. But if you want to take a bath in your bathtub, that is totally fine. Boobs. Maybe you're breastfeeding, maybe you're bottle feeding. If you are bottle feeding and not planning to breastfeed, your milk still may come in. You're going to want to wear a tight sports bra to kind of help with that. Motrin for some pain. And then if you're breastfeeding, that is a whole journey in and of itself. So lifesavers for me, these are my silverettes. I have talked about these many times. They are silver little nipple covers. You put them, basically I wear them on my nipples 24/7 unless baby is eating. They are silver. They help with moist wound healing. So there's nipple creams, there's nipple butters, there's all these different things. I didn't love any of the creams and butters. I thought they were kind of greasy. And so these kind of accomplish the same thing, really help sore, cracked nipples in those early days to heal. Because babies cluster feeding, they say the old adage is, baby eats every 2 to 3 hours. Yeah, breastfed babies are on the boob all the time, cluster feeding so much in those first few days. And that is great. You want your baby to cluster feed. That is what is telling your body and your brain that, hey, we need more milk to feed this little baby. Anytime that you're removing milk, it is telling your brain, hey, let's make more milk. So I use an app to kind of keep track of some of this stuff. It's called Huckleberry. There's different breastfeeding, pumping, diaper, different apps you can use. You tried some of the different ones, and I thought Huckleberry, the free version, was totally fine to help keep track of stuff. But I'm looking at how many times I logged that Hank ate on that 3rd day home, how many times he was on the boob a couple days ago. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17 times he was on the boob. And so like, again, your nipples, they're going to be sore. So something for nipple care is very, very important. What else? Pads. So some things that it does get easier. If this is your first postpartum, I promise it will get better. You will feel like yourself again. This first week home is really tough. I usually say, in terms of the last two, we'll see if it's true this time, I sort of started to feel a little more like myself around week 2, where I'm like, okay, this will end. I will feel like a person again. Because that first week home, you're just like, your belly's still really big. You just kind of feel like you have this deflated belly. Nothing fits. You are still bleeding. Your bottom really hurts. Your nipples are sore. You're leaking everywhere. Like I just wake up drenched and I'm just like, It's funny, when we were getting ready to go to the hospital before my delivery, I put on my nursing bra because we were going to get up early to go for my induction the next day, and I put on my nursing bra so I was ready. And it's just, it's these snaps, like, I just said, nursing bras, I'm doing this for the next year. Like, so like, just you're a little more mentally prepared for what's coming after you've done this. So I hope this experience helps you get through this as well. Other things in terms of waking up drenched every day, I use a haka at the beginning. So if you are breastfeeding, breast milk supply goes something like this. Right when baby's born, your milk isn't in yet, okay? So there's colostrum. That is liquid gold, high calorie, wonderful, nutritious stuff for baby. Baby has a tiny little tummy. They don't need tons of milk. They just need that colostrum, and that cluster feeding all that time on the boob is going to bring your milk in. So at the beginning, it's not enough. Okay, then your milk comes in and it's way too much. Okay, and so Goldilocks here. Eventually we get to just right. So not enough right when baby's born. Then it gets to too much, and then it settles out at just right. And so in that too much phase, when your milk comes in, often you will find yourself leaking breast milk when baby's eating on one side. When it's time for baby to eat, you're let down, just whew, I'm soaked. So you can use a haka or other milk collection cup to collect that breast milk. And it really adds up. There are different like silicone cups that you can just like put in your bra that passively collect. The haka does have the ability to have a suction, like you squeeze it and put it on and it will suction on. Generally, we don't recommend doing the suction too much. You just put it on to get it to stay to collect the milk, because if you are sucking out that milk, it can induce a little bit of an oversupply, because if you're sucking the milk out, that again, you're telling your body, hey, I need extra milk. And so you can run into some trouble if you have a big oversupply. And that's things like clogged ducts, mastitis, things that are not fun. And so generally we say just use it to collect that milk. Don't put the suction on. So that's pro tip for not being soaked. Like there's different breast pads and different things you can put in your bras, but again, then you're not collecting that milk, and even to collect a little bit in a haka adds up, and then you have a little milk in your freezer or your refrigerator if you are going to be introducing a bottle. Other things in terms of pads, randomly, something I have found that helps a lot is I like to pick a pad that is like organic cotton on top. I haven't loved some of the like different brands have like a synthetic, plasticky, silky feeling kind of top. Don't love it. Don't know if it's just me, but I have liked the feel of organic cotton, like a cotton top pad. Weird. Hope it helps you. The other one's just like, I didn't like. So that's my pad pro tip. Final thing, other things to sneak home from the hospital, little Peribottle to have. Again, things are still very sore, very healing. You may have stitches in your bottom. Peribottle, fill up with some water so that when you pee, you can squirt water while you pee so that the urine isn't hitting your stitches and your cuts, so that it doesn't burn. And then also then you don't have to wipe with toilet paper or something else. You are all clean and refreshed with some water. So I brought home one other one. So I have one in the diaper bag in case we're out and about, have one in both bathrooms at home, because you never know where you're going to end up. Finally, other things, I have this belly support band that I really like, that I wear a little bit in those early days postpartum, because again, your core is just gone. You have been growing this little human for 9 months. No matter how careful you are with your core, it's just really stretched and has been working very hard. And so again, you have a little bit of that deflated balloon and not a ton of core strength. And so this one is from Belly's Inc. I got it a long time ago. There is a whole little like booklet of postpartum kind of gentle exercises that goes for 8 weeks that I don't know where my booklet is, but I remember most of the things in terms of gentle exercises to be doing, which is breathing. I am doing breathing exercises every day. 2 sets of 10 where I go and really relax the pelvic floor and then really work on that core connection breath. Something else you may notice postpartum is some incontinence, which was something new this go round that I hadn't had before. If I let my bladder get really, really full and I'd get up to go to the bathroom, sometimes I would find I was like, I think I'm leaking. Am I bleeding or am I peeing? I'm not sure right now. But I think there was a little bit of, if my bladder got really full, I'd have some leaking. And so that is something that happens very, very commonly too, is some incontinence after delivery. Your pelvic floor is just passed a very not small object through it. And so it can put some stress on that. Another reason to really focus on that core connection breath and engaging your pelvic floor, because you do not want that incontinence to last long term. Very normal in the immediate postpartum period. It is one more reason why I say, talk to your OBGYN about a pelvic floor physical therapist and getting into pelvic floor physical therapy. Even if you had a beautiful delivery and no tears and everything's fine, if you have the opportunity to do pelvic floor physical therapy, I would so highly encourage you to do it, because they will really help you rehab that pelvic floor. So C-section recovery is the flip side of this. I have not had one. They are really tough, right? You just had major abdominal surgery. And now you also have to go home, walk yourself around, take care of your baby, and do all these things. And so it's funny, I have had friends who've had vaginal deliveries and then had a C-section, or a C-section and then vaginal deliveries. And some people felt their C-section recovery was easier than their vaginal delivery, and some people vice versa. So it really depends on you. But again, a C-section is major abdominal surgery. And so you want to make sure that you are really taking care of yourself, staying on top of your pain. Okay. Keeping that incision clean and dry. So after 24 hours, it's okay to take a shower. You want to let that warm water wash over it, soap and water, and then pat it dry. It is most of the time now closed with sutures as opposed to staples that are going to dissolve on their own. Usually there's also going to be what we call steri strips. It's little white sticky pieces of kind of like a Band-Aid that are also kind of holding the edges of that incision together. Those usually start to fall off at the 1-2 week mark. We say when the edges kind of start to come off, you can trim them. And then once they're really after that 1 week mark, if they're coming off, you can just take them off. Again, staying on top of pain meds, ibuprofen or Motrin around the clock if you don't have any contraindications to any of these pain meds, as well as Tylenol. There is a big push these days to not use opioids for C-section pain control. That's all well and good, but you are going to have real pain. So if you find that you are having really intense pain and your Tylenol and Motrin aren't cutting it, talk to your OB, talk to your team. You are having real pain. Sometimes you do need some of those stronger pain medications. Which brings us to again, that support belt or some kind of C-section support belt and abdominal binder is something very common for C-section mamas, that they really find those helpful, because in addition to a weak core, then we kind of cut into your abdomen, and so really feeling weak and tender there. So an abdominal binder is something you may want to look into, or they may have at your hospital. And finally, if you are taking those pain meds, especially the stronger ones like oxycodone or opioids, is constipation. So you don't want to be constipated if you had a vaginal delivery or a C-section, because that when you increase that pressure to have to poop, it's going to really, really hurt. And if you just had a bunch of stitches in your bottom, you don't want hard poop where you really are pushing. So taking a stool softener. Interestingly, the one I would take is Miralax. It is a powder. You can put it in whatever beverage you enjoy: coffee, milk, tea, juice, whatever. And it's gentle. So it is a mush, not a push. And it is effective. Another one people like is Senna. Colace is a really popular one, which they did give me postpartum. But when you look at the studies for Colace, it's actually not that great of a stool softener. So I would tell all my patients, hey, take Miralax. We have a big jar in our cupboard. So preventing constipation. The rest of the things are like, hey, you just ran a marathon. Ask for all the help you can get. Have your partner or support bring you baby. Let them do the diaper changes. Like you just did a really physically demanding thing, and you need to rest and recover as much as possible. So make sure you are eating enough. Make sure you are drinking enough, especially if you are breastfeeding. Keep your handy dandy giant water bottle nearby. This is my newest fave. It's a Brewmate Era, and here's why I'm obsessed with this thing. It is legit leak proof. You can shut it so it doesn't leak, and this straw is silicone. It's soft. It's stainless steel on the inside, but my toddlers are constantly carrying around a water bottle, and I'm just so worried, like with my Stanley, that they're gonna fall and pop that straw through the top of their mouth or cut their lip. So anyway, this is my favorite. I digress. The first week's home is really tough. It will get better. Snuggle that sweet baby as much as you can. Know that it's really hard. It gets better. You can't spoil your baby, so keep snuggling them. And if you have any concerns, like keep an eye on your mood. Some overwhelm, some emotions are very, very normal. There's a big hormone drop. But if you find you're crying, you're not enjoying your baby, you do not feel safe, call your OBGYN, tell your partner, call your pediatrician. We all want to be here to support you. And remember, if you're losing it, baby's losing it, it is totally fine to set that baby down in a crib and let them cry for 5 minutes while you just have a centering moment, take a deep breath, and then go back, okay? They will be okay. So anyway, good luck. I am here in the trenches with you, but hopefully this helps make your first week home go a little bit more smoothly. Mamas, partners, if you have any tips, things that you found useful, helpful, really key in that first week postpartum, will you please leave them in the comments below? Because the community here loves support, different ideas and things like that. We will check in again next week with that, see how it's going on our second week home with sweet little baby Hank. Make sure you're subscribed to get all of our newborn content coming your way soon.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.